if I have a lot of money and a lot of time, my first option is zirconium because it looks very natural. It's a wonderful material.
So always we prefer give something permanent. I mean, it's like I say, it's still temporary for 6 months, but it's completely attached with the implants.
The thing that I don't like about zirconium is when people bite. And people that have zirconium hybrids, they're gonna notice when people bite when they have full zirconium, it sounds like plate.
Welcome back to Supreme Dental Podcast. My name is Frank Navarro. My wife and I are the owners of Supreme Dental Clinic. You could be anywhere else in the world right now, but you're here with us, and we appreciate that. Don't forget to subscribe and like. Also, we have an email address. We have a phone number where you can give us a call, leave us an email. Any questions or concerns, remember, this podcast is for you, the patients. And today we have 3 very special guests. We have, to my right, we have Dr. Alonso. And in front of me, we have Dr. Luis, and we also have Dr. Elias. Now, all these doctors are implantologists, and we're really going to pick their brains today on different subjects. And the subject that we're going to talk about is about hybrids, about all-on-4, all-on-6s, pro arches. Alrighty, so welcome, guys.
Thank you.
Thank you, Frank.
So one of the main questions that we get is patients asking us, well, there's so many different options. You know, there's the acrylic composite, there's the Zerpic, there's a zirconia. How do we know what is for what patient? How do you guys define? How do you guys explain? How would you explain it to the patients out there?
Okay, for example, when we explain this situation for the material, we have a different options. For example, the hybrid is a material with 2 or 3 components, different metal, PIC, or zirconium. Okay. Now, in my opinion, in my experience, the best option is the Zerpic. Why? Because with the Zerpic, I can fix any problem if the denture is broke or has any problem in the future, because that is normal. I need maybe 1 day or 2 days for the solution. But for example, in zirconium, when it's a structure of zirconium, the problem is a little more big. Why? Because I need to change all the structure. No one piece or a little piece. It's all the structure. It's a long time. It's very, very expensive. Not a good solution. That way, in my experience, the best option is Zerpic. How you think, Dr. Elias?
Oh, well, I think continuing what you were saying, that probably the acrylic and metal has probably stayed in the past a little bit. Probably at first, it was the first option. We're talking about years back, because of the zirconium and other materials weren't developed as far as they are today, right? What we've noticed is with the metal acrylic, we could probably use it as immediate loading. So we can wait until the tissues actually finalize healing, right? But I think at the end of the process, we're looking for something that's more comfortable for the patient, something that's better looking, something that's going to last a little bit longer. Why? Because acrylic, it breaks a little easier, right? With zirconium teeth, either if it's full zirconium or Zerpic, the teeth are a little bit they're not a little bit, they're more stronger, right? People could bite into things that are stronger and have no problem at all. With metal acrylic, we have to be careful with what people bite into. Another thing that we must also look into is the person, the patient. What type of patient are we dealing with, right? If they grind their teeth, if they're young, right? If we have younger patients, they're probably going to be stronger. Males, big men, tend to be stronger. So we have to use something that's stronger for them as well.
Yeah.
Well, what about you?
That's correct. Well, yeah, like you say, Dr. Elias and Luis, in market exists a lot of kinds of dentures. Like you say, Zerpic, hybrid dentures. Usually, right now we are trying to use one polymer. It's a bar. It's a metal bar or PIC bar with a polymer. This is PMMA. This is it's a polymer. It's a really good material. It's a little bit more strong and looks really, really nice. We are trying to use because it's a new material for us. So we have like a month using this kind of material, and well, actually looks really, really good. And the thing is, we decided to use this kind of material because in hybrid denture with acrylic, usually the teeth come out. So yes, that's a really it's a big problem because the patient have to come back here. We have to fix. It's pretty normal. But we have to avoid that kind of situations. So that's the reason we are trying to use this kind of material.
So let me ask you guys a question, because also there's patients that ask about the metal porcelain option. Do you guys recommend the metal porcelain hybrid? Do you guys like it, or why isn't it really, given a choice to the patient about that?
Is for example depend, because any patient is different, and some patients has a high smile. When the patient has this situation, it's necessary recommend a different solution for that. For example, PF1 is a denture with only teeth. This structure don't has gum color. It's a different solution. It's possible with metal and porcelain.
Is that like a 3-on-6?
No. It's possible with all on 6 or 3-on-6. Depend.
Okay.
Every patient is different. Okay. But for example, when the patient has a good lip support, I can recommend a hybrid denture with acrylic or.
What about the metal porcelain?
Okay, yeah.
I think the thing about the metal and porcelain is that the porcelain chips off the metal a lot. Yeah. A lot. I mean, I've seen it in the past. I've used it, not a whole lot, but it always chips. And the thing about that is you can't repair it easily. You have to remove the whole structure. The thing is, it's how it's made in the lab, right? You have metal, and then they put the ceramic on top, which is going to be the porcelain. But it's very easy for it to chip. It chips a lot. And then it's not easy to repair. You have to redo it all over, but you run into the same problem that it chips, the porcelain chips.
So that has nothing to do with you guys. It's just the porcelain chips, and now the patient's back.
Right.
And you guys have to take off the structure and send it back to the lab.
Yeah.
So I could see where it could become a headache. So now what about, you talked a little bit about zirconia. So we talked about acrylic, as we know that it's the most common use that there is worldwide. And there's nothing wrong with it. Actually, it's very aesthetic. It's very nice. It's lightweight, but also it's normal for teeth to pop out. There's really not much we can do about that, and that's a commonly known issue. It doesn't happen all the time, but it does happen more than not. So now tell me about the zirconia structure, because there are structures that are just pure zirconia, and I heard they're extremely aesthetic. But what do you guys think? What's your opinion on it?
Well, zirconia structure is, to be honest, it looks really nice, really, really natural. But the thing here is, it's just one piece. It's a full zirconia. It's a full zirconia. It's the zirconia bar and the teeth zirconia. Everything is zirconia. So the thing here is, like I say, it looks really nice, looks natural. It's very, very easy play with the size of the teeth, with the colors, with the gums and everything. But I think that the thing that I don't like to match place in my patients, this kind of treatment, is because if the zirconia if the structure, for example, a line of fracture, when they bite down really hard, if this structure have a line of fracture, we have to replace everything. It's not just the tooth. It's not just the bar. We have to replace completely everything. Why? Because it's just one piece. So that's the reason we don't. Like I say, it looks really, really nice. But to be honest, I like to avoid that situations, because if the patient needs to come back again, it's necessary for at least 6 days, and sometimes the patient doesn't have that time to replace all the structure.
I agree with you. Yeah, in my opinion, is the same. The same situation. Okay, the cosmetic is the best. Zirconium looks very natural, very, very good, but the solutions I don't like. Okay, not economic solution. It's a long time. That's
Actually, I think it's the most expensive. The material is the most expensive.
It's the most expensive material. Yes.
What about weight? Because I've heard that it's a heavier
Oh yeah,
It's a heavier structure.
Really,
so
heavy structure.
Very heavy, yeah. If you compare it with a different material, for example, metal acrylic and Serpic, zirconium, you can check what is the most heavy material is zirconium. Maybe 2 or 3 things more
Times-
heavy.
times more.
Times more, yeah.
Okay.
Welcome to Children's Dental Facts. Did you know that only 32% of children brush their teeth? You heard it first at Supreme Dental Podcast. If you didn't know, well, now you know.
So now when we talk about the Zerpic, which is something that we've been working for several years. Actually, we were one of the first clinics that brought it here to Los Algodones, Mexico, was the Zerpic, which is the PEEK material, and then it has zirconia crowns cemented onto the little nubs, just like if you were to prepare someone's full mouth restoration. It has the little nubs and all that. What do you guys? What is the take on that? What do you guys think about that structure? Do you think it's something that's worth investing on for the patients? They would want to know all these things.
Well, taking back the previous question, because I didn't get to answer, I think zirconium is also a good option, right? But we have to evaluate the two things between Zerpic and zirconium, right? They're very similar. I think, as you mentioned, it tends to, when it breaks, it doesn't happen a lot, but when it breaks, you have to repair the whole thing, right? We have to look at this as an investment as well, right? What's easier to give a maintenance to? And I think it's Zerpic. It's a little bit easier. Zirconium is a little bit more biocompatible towards the gums. The thing that I don't like about zirconium is when people bite. And people that have zirconium hybrids, they're gonna notice when people bite when they have full zirconium, it sounds like plate, like 2 plates clinging onto one another.
Oh, you hear that?
Yeah.
Yeah.
Click.
It sounds like pretty much like plates hitting onto each other, and that's the first thing that patient notice, right? With other materials, you don't get that, right? Because with, let's say, Zerpic, when people bite, we have the perimeters, and it takes away that force. And
It gives away kind of like a shock.
Right.
Yeah.
Kind of like a shock. Okay. So one of the things that I looked into also myself, obviously, as you guys know, I'm not a dentist, but I've researched that the PEEK product, it's the closest thing there is to a cortical bone. So it absorbs more of a shock like the cortical bone normally does when you have your natural teeth. So it absorbs shock, and I believe it was anywhere from 80 to 90% away from the implant itself, offering the implant better lifestyle, better lifetime.
Right.
Yeah. Remember, for example, in the mouth, any structure has the properties is hard.
The properties.
The properties. Yeah. And for example, the ligament, the gums, the enamel, the cement, it's flexible.
Mm-hmm.
Okay. If you show is for flexible material, you can give the patient the same properties.
Like a more biocompatibility with the patient.
Yes, of course.
Biocompatible.
Yeah. That's why when the material is flexible, it's much better.
Continuing on what Dr. Luis mentioned is that one of the main difference between teeth and implants is that teeth themselves, they have a ligament around the root of the tooth that serves like a shock absorber, like in a car, right? So every time we bite, the teeth tend to move a little bit. Implants do not. Implants are stuck to the bone, so they don't move at all. And a lot of patients notice the difference of having their real teeth and having implants. That's why people that have, let's say, full mouth restorations of zirconia, it doesn't sound the same way when they have implants, because the implants don't have that shock absorber. So we have to take care of that as well, right?
Right.
All right, so now we're going to talk about if you guys were to have this done on your mouth, what would you pick? Which one would you pick? If you had to have all your teeth pulled and you had to pick a material, which one would you pick?
I think, to me, I think the best material for me, in my case, I think is a Zerpic. Yeah, if in one point I have to pull out all my teeth, for sure the best option, the best way to replace my teeth will be place implants. And probably Serpic is the best solution for me. Why? Because we are talking about that situation. It's a big bar. This is a structure of big bar. This is more flexible, and all the teeth are zirconia crowns, so it's really easy to fix. So in my case, I prefer that. I mean, in my patient, I prefer to keep that a solution.
Right.
For sure, in me will be the same thing.
I'm gonna explain a funny solution to me. If I have a lot of money and a lot of time, my first option is zirconium because it looks very natural. It's a wonderful material. But if I have a lot of money, a lot of time, is my first option. Okay, but depends. Economic of the patients is different. Okay, because the other material is the Zerpic. It's a good solution too. I agree with you.
Mm-hmm.
I think I would have Dr. Alonso and Dr. Luis work on me. That would be my choice. That would be my choice. Them doing the surgery.
A dental fantasy right there.
Yeah. My opinion is because obviously it's a big risk. The zirconium, full denture with zirconium is a risk. Always is a risk.
But if you have all the time, you have all the money, you can replace anytime. So
And we're the dentist.
So what about you?
I think as Dr. there's a lot of factors that we have to factor in, right? I mean, I'm a dentist. I work here at the clinic, so it's easier for me. I know the guys at the lab, so it's easier for me to actually do the whole thing all over. I think I would pick zirconium just because of that. But if we had to put in other factors of maintenance and how easier it is to replace, and I think I would go with Zerpic. But it's really close. I mean, it's really, really close.
Oh, that's gold right there, because obviously we know that different patients have different outtakes on different materials, and getting that aspect from you guys. If I had to pick, I would pick acrylic.
Yeah.
I'm just kidding. I would go for Zerpic.
Full dentures.
I want the natural stuff. I would go for Zerpic myself, because I feel that it is lighter than zirconia. So on my upper, I feel that depending on my bone structure, that it would put less weight, and I don't like the sound. I hate that. Actually, when I'm at the store, I can tell when somebody has dentures. Because when they're wearing, back in the day, there used to be a lot of porcelain dentures. Remember those?
Yeah.
Everybody wanted porcelain dentures. And I could hear it. And it sucks, because now I'm watching a movie, or I'm at the store getting some for one of my kids, and I could just hear that. Yeah. It's like I filter the whole world out, and I could hear that. And now I started to hear it a lot less, because there's new materials coming out.
Right.
And I feel I would go for Zerpic myself. But I think it's everybody has to do their homework to see what's the best for you. Obviously it's what's the best money-wise. Remember, it's an investment, so you want to do what's right for you. And there is no right or wrong answer to this. It's just preference and obviously bone structure. So you go off of your wallet, and you go off of what your dentist tells you, and then you make an ethical decision. I think that's the best way to do it. But so talking a little bit about that, and not taking away from that, I want to talk real quick about immediate loads, okay? So immediate loads, it's something that, if I'm not mistaken, you guys immediately load onto the implants if the implants are strong enough, if the bone density is good enough. You get to put these those different type of the thicker implants, longer implants, be able to give the option of immediate load. Now, what's the big difference between an immediate load, because it's made out of acrylic, from the final product, if they were to pick acrylic 6 months later? What's the big difference?
Well, when we are doing this kind of treatment, all on 4 or all on 6, we have the chance to make the immediate low. That's mean a place it's still temporary, but it's attached with the implants after to do the surgery, probably by the next day. So if those implants have more than 35 newtons, if the implants is really, really attached with the bone, we can place the immediate low. This denture attached with the implants. So that's the best solution, because I explain all the time to my patients, the full dentures, the regular dentures, for temporary for 6 months is really, really uncomfortable. It's too wide. So always we prefer to give something permanent. I mean, it's like I say, it's still temporary for 6 months, but it's completely attached with the implants. So in we have to explain is like I say, is something temporary. They have to eat some the diet will be liquid and soft. But soft food, but it's a really big difference if we give something attached with the implants, or the other way, something removable. So that's the difference.
I think at this point, the way dentistry has developed itself, it shouldn't really be an option. People should always have teeth immediately loaded onto their implants. There's even studies out there that show that the implants do a whole lot better with pressure being applied to them. Also, the patients are happier. And I think that's very important, as Dr. Alonso mentioned, that people that have the dentures for the 6 months, they go through hell, right? And I've seen it. We talk to the patients. We do this a lot. We do this treatment a lot. And we see how they didn't have fun those 6 months. Then there's also options towards the material. The materials obviously is going to be something temporary. Or we could do either PMMA or acrylic. The difference is that at the beginning, the difference between like doing the final restoration with metal acrylic and just another material is that at first, the first couple of months, it's going to be very soft foods, right? That's not going to change.
Why is that? Why can you, with your immediate load, only eat soft foods, but with your acrylic 6 months later, if you decide to go with acrylic, why is it not soft foods anymore?
Because the implant still has to the bone around the implant still has to heal around it, right? And and it's not mature enough at the beginning, right? Now the difference in 6 months, 4 months, or how much time it is, depending on the patient, is that once they fully heal, people are going to start biting into things that are a lot harder, right? And the acrylic usually tends to break. But during the first few months, because the diet it's not as hard, it doesn't break, right? And we always try to do, because we were talking about that the other day, that as we saw that another clinic used zirconium right away, but we're not really sure on how everything is, the gums, everything is going to heal, right? And we don't want spaces at the final restoration underneath our gums. We want to make sure everything is tight, that it's flat, so food doesn't get stuck. So everywhere around the world, people are doing temporary materials for immediate loading, and once the implants are healed, that's when we jump into the final material.
And remember that temporary material is lighter, okay, because it's just acrylic. The difference with the final restoration is because the final hybrid denture has a metal bar inside.
That is correct.
It's heavy,
yeah.
Very heavy. I don't recommend in the first time, okay? It's necessary the healing process for 6 months. After this time, the surgery is ready for the final hybrid denture.
And then I also heard that for the temporary dentures, it's extremely easy for a tooth to come out because it's not as strong as the one that is in metal, if I'm not mistaken. Like it tends to have more teeth pop out. Is that real or is that fake?
No, it's a real situation. Okay, always is real. Why? Because the muscle, remember, has a memory.
The muscles.
Okay,
Yeah.
when you make the denture, probably the first month, the first 2 months, 3 months, everything is normal. The bite, everything. Everything is a new bite. Is a new muscle memory. Is normal. In this time, the patient move the jaw, for example, a little more right or left, or front. Why? Because everything is new. That way, it's normal. The patient broke the acrylic or the teeth or any structure. Okay. After 6 months, 7 months, when the bite is stable, is probably the patient don't continue with the problems, with the fractures.
Okay.
But it's time. It's necessary. Okay.
Time. All right, guys. Well, thank you so much for being here with us today. Like I said, don't forget to like and subscribe. Thank you so much, Dr. Alonso.
Thank you, Frank.
Thank
One
you.
of the best looking dentists in Mexico. Thank you so much.
Still
Still
the same.
And he just came back also from Argentina. So I have Argentina training here in front of me. We have Dr. Luis. Thank you so much. We appreciate all you do. He just came back from Harvard University.
Thank you.
And then we have Dr. Elias, who has a killer look, and but he's a teddy bear, and he just came back from Canary Island, Spain. So thank you so much, guys. We appreciate that. Don't forget to go ahead and send us an email, give us a call, and we'll give you guys a shout out, any concerns or questions you guys have. And thank you for watching Supreme Dental Podcast, sponsored by Supreme Dental, where smiling starts here. Thank you.